Hello, everyone. I'm Dr. Ioanna Nixon.
Dr. Vilma Pacheco Barcia from Open Doors podcast, two women scientists driven by curiosity, evidence, and compassion. Welcome back to another episode of Open Doors, the podcast where we explore leadership, well-being, and the human side of oncology.
And today, Vilma, it is me and you. Yeah. And that brings me back to how we met when we actually, cheers. When we were discussing about how do we talk about all these concepts that we know all our colleagues are interested in. How can we create a forum for that? So I'm so happy that it's us today to reflect on some of these wicked things that we all in the oncology world think about. So coffee with the hosts, yeah?
Yes, cheers to that, Joanna, absolutely. I'm really excited because when we started talking about the podcast, when we started shaping that moment when we said, how are we going to say, what's going to be the name of the podcast? How are we going to call it? And I remember us perfectly saying, we should talk about things that open doors to good things. And you said, yes, that's the name. That's Open Doors. And after this first season and all the guests that have came from now until now, I think it makes total sense. It's amazing to hear the individual aspects of everyone, how everyone faces well-being. It feels liberating, as you were saying in Mark's episode. It feels liberating to hear your colleagues that we all struggle with similar issues, and we can work as a community to be better, to feel better. Joanna, today I was thinking because we've spoken a lot about well-being in the last episodes, but something that worries me a lot and I would like to discuss with you is it's
Mm-hmm.
success. We've seen leadership, we've seen mentorship, we've talked about sponsorship, we've talked about many things. And that brings me very nicely to what does success really mean in oncology?
Yeah. And it's, I don't know, it's really interesting. And there are so many approaches to that. And I'll take a step back because in in our world with the current pace and so many noise around us and social media and access to all the information that we wouldn't have in the past necessarily, and people no I wouldn't, well, people crafting um their image and their life through social media that they want others to see. So I'm talking about reference points. And if we talk purely about career and success, one of the first things to ask is, what are the key reference points? Are these reference points unique to the individual? And probably these are. And these need to be aligned with the values. And one of the things that I frequently use about success, funnily enough, is when I speak to my patients and the patients ask, will the treatment be successful? And I think this is one of the bridges that you can use to ask the question, what does that mean to you? What does that feel to you? What would successful treatment be? And that's a starting point. So success in oncology, would you like me to answer at a personal level, or what do I hear from people who come to me, from the younger people that come to me to have discussions, conversations in the context of mentorship or executive coaching? What would you like me to?
I think the major confusion is that traditionally, when I think of success as the word success, I think about publications, grants, promotions, and of course, those are important. It's something we've discussed in previous episodes. We've discussed it with Marcus also. But I agree with you that there are moments that stay with us that are not like literally in our CV. There are other type of victories, the human side, and I want you to maybe let's start talking about the human side, the emotional side of our patients.
Very important, because as I was listening to you talking, there's a difference between asking the question, how can I be successful when I apply for this position or for this for this grant, for example, what would make this successful an application, or what would make me a successful candidate? And that is success in a way. And you mentioned the publications and all of that. But success, what success deeply means to each individual is very unique and different. And likely it has nothing to do with external validation. And I'm not referring to major impact through your work. For example, if you have led research that shifted the paradigm for treatment of X disease, this has got massive societal impact. I'm not talking about all that, but I'm bringing the bigger picture. So, success is deeply personal. And a lot of our guests, when we were talking about what keeps them going, why they do what they do, they did not refer to success, although they're very established. They refer to the human connections and the fact that they go back to practicing gratitude for being there and for serving others, for being blessed. And I'm using different guests' words around that we are blessed to be in that profession. And frequently, because of the noise, because of how overwhelmed we are, because of burnout, this we forget about that. There's so much going on. And it's really important to pause and think about that, because yes, it's not about success. It's about helping others. And every day, irrespective of the number of publications one has or a bank account, for example, we go to work and undoubtedly we help people. Undoubtedly. And anyone who is involved in health and care does that, irrespective of their role. They might be consultants, they might be junior doctors, they might be nurses, they might be physios, they might be the staff nurses, porters. And maybe somebody might think I'm romanticizing the profession, but it is true. And there are times that all of us need to reframe, because there are times that we all get overwhelmed.
Yes, and also I think that something that is very important that is that we all help in many ways, and also that we can also help even more. Like, we need to be self-aware. We spoke about this in many of our episodes with many of our guests that are well established. Actually, I remember in episode 5 when we were speaking to Dr. Amaral, we spoke about leadership. We spoke about how we work with teams. And it's not only how we help the patient, it's how we help between us as colleagues, as peers. We grow together, and I think that's very valuable as well, Joanna. And and I think that this makes us we are a global community. We spoke about this with Sergio, with Dr. Cifuentes. Like, he was in Mexico, now he's in Colombia, but we do oncology in different countries, in different continents, but we basically help people. We love doing that, helping our patients. Also, Joanna, well, you've done a lot of leadership roles, and I think something that I appreciate a lot in our last episodes was that we spoke about compassionate leadership, that leadership has evolved in a beautiful way. We've spoken with some of our guests about women in oncology, how leadership is evolving, and I think that that is amazing too, that we can lead in a very positive way.
It is, because if you think of the traditional models of leadership, they're very autocratic, they're very command and control, and there's always, a leadership style that is, it comes in with it's in your nature to behave in a certain way, I suspect. With reference to Michael West's work on compassionate leadership, that we did have guests that were speaking about that. I have seen that in action, especially during COVID, and compassion can be viewed as the secret ingredient the glue that connects everything. And it's a win win because it improves, we know that from research, that it improves patient care and it improves individual resilience, staff resilience, and team resilience, and corporate resilience. The issue is it's not as easy as it sounds, although it doesn't cost. We know that there are factors that impact on how compassionate we are. And as I said, every morning you wake up, think of yourself, you wake up, I know that you have an hour for yourself, and then you go, you sort out your kids, and then you go to your clinic. And by no means you go thinking, oh, I don't want to be the great doctor, the patient advocate, supporting others. You go wanting to be that person, but it could be that you're exhausted, there's a bit of burnout, there are other factors that come into play, and you're not as compassionate as you want to be. I know that sounds like an excuse, but nobody is perfect. So self awareness, as you said, is key. So checking in with yourself.
Absolutely. And giving burnout and professional well being the importance it has. I think maybe 10 years ago, we didn't know as much as we know today about professional well being and about burnout. So I think it's wonderful that in this podcast, we have leaders and colleagues and peers that want to talk about it, want to talk about professional well being. Also, speaking about leadership, I think it's very nice how we see that it's not the same early career leaders than mid career leaders than senior leaders. There are many ways to lead. It's true that compassion is the glue for all leaders, for all teams. But it's very nice how we see here in the podcast how not junior doctors, but junior leaders, I must say, like in a rough way, like early career leaders are very different from senior leaders. And again, they all show compassion. And I think that's brilliant. That's wonderful.
Yes, and there's a lot of individuality in styles, as you mentioned, and we have all the younger generation stepping in and stepping up. And as we discussed in the podcast, which we support hugely, is the concept of mentorship, that it's not nice to have, but it is essential. And there are environments, as we heard by Dr. Liu, that where mentorship is established. But we know from Sergio that that is not the case everywhere. So there are a lot of inequalities there.
Absolutely. And actually, when we see the international programs, we can find how there are many, like ESMO mentorship program, Ask Idea program. And at the beginning, you might think, why do we need so many mentorship programs? And that's exactly the case. Dr. Liu's research basically demonstrates how important it is to have a good mentorship and how it can have a positive impact in your career and also maybe lower the risk of burnout. Actually, having that back, and also having someone to learn from. I think mentorship it's gemstone. It's like a diamond. And if I had to choose something very important in our career, I think it's definitely mentors. And we can also talk about sponsors. But eh, it's not something that we're used to talk about. You know what I mean? It's like we see it maybe in some conferences and we see that mentors are important, but on a day-to-day basis, it's not something that we're used to talk about.
No, and yeah, that's very true. I'm just thinking, approaching that through different lenses. When we appoint new consultants in the NHS, um, these new colleagues stepping into the role of, having an autonomous practice, they do need mentorship. So not every department has got formal mentorship programs, but even without that, it's important that we understand that informal mentorship needs to be in place because we do need to support the younger colleagues, and equally the younger researchers, the younger doctors. And it can be formal or informal. And you also mentioned sponsorship, which is a very interesting concept. And I remember Teresa Amaral speaking about that. It's whoever speaks about you, recommends you when actually you're not in the room. So there is somebody's looking for X contribution, and they say, yes, this individual would be perfect for that role, and that is sponsorship. And I think, irrespective of the terms, that happens. It does, because it is in human nature, isn't it?
Yeah.
Yeah,
And also, Joanna, it's true that it depends on the environment you are. Not every team has the same compassionate environment, or not everyone is the same. We're all individuals. We behave differently. We have different goals. So I think it's also important to see how we can see a future together, how we can solve issues, solve problems in a compassionate way, and also give us, this platform, for example, a space to talk about it. As Mark said, he was grateful in his episode of having this place where we can speak up and say how we feel, not just the well-being part, everything. And that includes emotions, Joanna, because our work here, we help patients in a very, very difficult moment of their lives. It's a complete difficult, different scenario when a patient is diagnosed with cancer. They have to absorb so much information. On the one hand, terrible information that they have a cancer, and then all the information regarding a treatment they don't understand. I mean, many patients do, but at the beginning, if you're not a doctor or you're not used to the words, it makes it even harder. And I think, Joanna, it's nice. We should discuss also how emotions evolve in our consults.
absolutely. And how you handle that in the moment, and how you don't carry that with you every single second of your life as well, because that can be consuming, is what we said. Yeah, what we speak about, compassion fatigue. So you need to practice leaning into that space, leaning into the mess, but not falling in there, because at the end of the day, if that happens, you're not going to be able to support the patient or the colleague. Yeah, but you're referring to patients. Yes, we do have emotional consultations, and if you ask me, have I been emotional? Of course I have been. I am human. Have I been devastated because, you know, a patient of mine, um, a young patient of mine, did not do well because cancer took over? Of course. But I think we do need to find ways of managing that. And we speak a lot about that in the podcast. We need to prioritize on self-care. We definitely need rituals. We need some rituals, even, during a busy clinic, in between patients. We can't carry on without that. Can be washing your hands, for example, and actually cleaning your mind, because you can't enter the next consultation without having cleared your mind from what happened before. Take a breath and then continue. And I'm not sure that we actually do these things. Probably we press the button and we're like, okay, let's go and get on with the clinic. Forget about all that. But then that adds up, and it can become one day incredibly overwhelming. Does that make sense?
Yes, absolutely. And actually, it reminded me also of that moment where we're in the consult and there's a mix of grief and hope. Because once you get the diagnosis and you explain to the patient all the options, there's this hope. And this is something we discussed with Jonathan Lim. He's a phase 1 clinical trials, and he said that was what he liked the most, that hope he saw. And Dr. Lou, also Jenny spoke about it as well. So I think that emotions are very important. I consider myself a very, very, very emotional person and transparent. So you can see my emotions, like I don't have to talk. You can just literally see me as an open book. And I I really take my time to try to understand my patients and try to read how they're feeling, and not just the patient. Maybe we should also give that importance to the carriers, the patient's family, as we spoke with Mark, and we also talked about that with Dr. Nikki Thorpe. How important it is to take care also of the carriers. I mean, what we were saying is that patients during that time, if they're, for example, vulnerable patients, as Nikki sees in her clinic, she see pediatric neoplasms. That's a very difficult scenario, and definitely children need help. So we need to support carers in every step of the way, from the beginning until after follow up. Because they're gonna be there helping them with the food. Um, I do gastrointestinal malignancies and pancreatic cancer the most at the clinic, and I see my patients' families all the time worrying about their nutrition, the support, and how to have the supplements or how to make the best meals. And I think that's wonderful, Joanna.
100%. And yes, it's not just, as you said, in the pediatric oncology world where parents basically, yes, are the carers and they accompany the child, or the teenagers and young adults. It's for everybody. I come from the world of uro-oncology, and I have a lot of men with prostate cancer, and they are, when they come with their partners, wives, family members, it's always better, because number one, they have support, and number two, they have a second pair of ears in the room with them, because we know, and there is research around that as soon as patients hear the word "I have cancer," then they shut down, or they can isolate things. They've got some selective hearing here and there. So it's important that they have somebody in the room taking notes. Or I don't know if in your hospital you record consultations. We don't do that. And then the patient can have the recording, so that they can listen to it with a family member. But the first consultation is crucial, and it's important that we look after the carers as well. In the UK, we're very fortunate because we have the clinical nurse specialist, and we've got teams to support patients and their carers. So, but I know in other systems that probably falls on the doctor, and that can indeed be too much.
Absolutely. And also, as we discussed with Nikki in her episode, which I think it's beautiful, because we talk a lot about radiation oncology and clinical oncology, all the work you do. Well, you do it,
Yeah.
Joanna, yourself, but I was, I'm a medical oncologist. So for me, many things are totally new. And I really liked that sense of how, with our work, we ultimately help patients. And that also includes technology. I mean, radiation has evolved enormously. I personally use a lot of radiotherapy with my patients. I have a very, very good, I do a lot of work with my radiation oncologist, because at the end, there there are a lot of disciplines that we have to learn. We have to be very, very, very active in our studying, in our day to day basis. And I think it's wonderful, Joanna, how we've spoken about all these themes in the podcast, how we were able also to explore other disciplines that we're not usually up to. And I think it might be interesting for our listeners to also, for us to maybe give some teasers on how the next season is going to be. So, our next guests, what are we going to see? What are we going to talk about? Maybe we're going to focus
Okay.
more on mentees.
We will have younger voices, because Open Doors is actually about broadening our perspective and bringing all voices on board. So we will have younger generations coming in and talking to us about what matters, and that's fascinating. We will be having more on leadership, and we will hear about women in leadership and in businesses, as well as compassionate leadership and distributed leadership. What else?
One of the main areas we're going to explore also it's quality improvement. I mean, not everyone talks about quality improvement and knows about it. And as we discussed with Emma, we're so used to see quality in every area that's not healthcare. I mean, to the supermarket, when you go to the airports, I go to any airport in the world. I've been to Thailand, I've been to Indonesia, I've been to Panama, United States, Brazil, and all airports have the question, how was your quality? It's a good way to say, we need to evaluate more. Talk to us a little bit more about quality improvement, Joanna.
Yeah. So we will, yeah, you mentioned Emma, and we will also have Dr. Amarsha. And quality improvement to me is literally everything. It's in everything, isn't it? And it's as simple as applying common sense that you would think is is what everybody widely does, but we frequently think maybe not. How did we arrive into this decision? That doesn't make sense. But with quality improvement, you make sense of things. You apply common sense. Yes, there is quality improvement science behind that, but it's not with all, sorry, whoever is a guru in quality improvement, excuse what I'm about to say, but it's not rocket science. Yeah, it is not rocket science. It's common sense that you apply, and you can have quick fails and quick wins. You apply PDSA cycles, and you have marginal gains, and you improve. You don't see improvement, you change your plan again, you test, change, and again and again. And that should apply in all healthcare environments and beyond. And it helps with team bonding as well. It has got enormous benefits. And yes, I am surprised that we don't frequently talk about that. And I wouldn't know about it, so I shouldn't be appearing as I've always known about it. It was a random thing. Again, it was in a leadership forum that one of my mentors basically mentioned to me that, oh, that would be amazing for you, Ioanna. Have you considered applying for for a position in this fellowship? And that was a fellowship in quality improvement, and it was one of the most transformative things I've done in my career. Meeting diverse, like-minded people and having instructors coming from very different industries, learning about communication, learning about science of improvement, visiting organizations like NASA and Microsoft and looking at how they apply quality, safety, how they treat staff, all of that stuff, well-being in Microsoft as well. So amazing things that open your mind. So whiteboards, I've got a whiteboard in my office, and I've got the whiteboard in my house as well.
I think it's truly amazing, and I cannot wait to show all the episodes we have been recording with our amazing guests. I would like to extend that we're grateful, very, very grateful to all our listeners and all our guests. They have been incredibly humble, nice. They were very happy to come to our podcast, which for us is a true honor. And um, I am really looking forward to the future and improving professional well being for us and for all the global oncology community.
Absolutely, Vilma. And a prompt to our listeners, not just to open doors for themselves and for others, but to also contact us. We both are very approachable with any topics that they think would be of help to touch on and talk. Because, yes, we would be happy to consider what our listeners think would be most helpful to them.
And also, if our listeners want to come to the podcast, we were very grateful for anyone who also wants to join us and talk about goals, professional well-being, mentorship, leadership, and all of
Sharing their
those
story.
aspects. Exactly, exactly.
This is Dr. Ioanna Nixon,
I am Dr. Vilma Pacheco Barcia from Open Doors Podcast.
and keep opening doors for you and for others. And remember, you belong in the room.
You belong in the room.